that someone will come up to me. No, they won't come up to me. Someone will email me later and say that they're vegetarian or that they don't eat a lot of protein. And when they increase their protein, they to uh, I tend to think of around 75 grams a day, that they notice that their dysthymic mood went away. And I've seen that dozens and dozens of times. We also want to help people stabilize their blood sugar. And so the goal of these changes is to decrease stress on the brain and body to help stabilize brain function. Um, so protein translates to of primary importance. And I think protein is adequate amounts of protein is one of the most important things for like a good mental health diet. Um, I think I've seen many, many women who are vegans get much better if they either take a broad spectrum amino acid blend or if they slowly add protein back into their diets, especially in the form of meat. So protein, remember that protein is the only thing in the world that the brain supportive neurotransmitters can be made from. So low protein, low serotonin, dopamine, GABA, endorphins. The amino acid tryptophan is the only thing in the entire world that can be made into serotonin. Prozac, Zoloft, any of the other SSRIs raise serotonin levels, but don't make serotonin. They make more efficient use of it. So that's pretty profound. It was pretty profound for me when I thought about that. So the takeaway is low protein equals low neurotransmitters leads to mood issues. So how much protein? So a good start, like, there's a lot of chatter around this. Some people would say 75 grams a day is quite low. I usually have people eyeball it using like a protein counter, like MyFitnessPal, not weigh foods, not get too obsessed about it, but shoot to get 75 to 80 grams a day. I find that most people are not eating 75 grams of protein a day. And so what does that look like? It looks like it's 3 servings of protein, often meat the size of your palm. Meat the size of your palm is about 25 grams, or 3 eggs, all of that is about 25 grams. And so having people use a protein counter and just this mindfulness, this tuning in can make a huge, huge difference. Eating to keep blood sugar stable. So blood sugar instability is a huge problem for mental health symptoms. It can lead to all sorts of things, mood instability, anxiety, panic, depression, even profound dissociation. So taking steps to level blood sugar can have a significant positive effect on mood and anxiety. So a diet like modified paleo, which removes added sugar and processed foods, can address most of the symptoms of hypoglycemia. Other diets can too, ketogenic diet. Often people need to pay attention to carbohydrates and how tolerant they are, how they feel as they eat more or less carbohydrates. And so I think the glucose goddess, that's her handle on Instagram. I think she's a really good user-friendly source of information. I can't pronounce her name, it's French. She has a great book called The Glucose Revolution. It provides good science and maybe about 8 hacks for blood sugar balance. And I think it's quite interesting. And so here are a few questions that help tease out if your clients or you or anyone have blood sugar issues. How do you feel if you go more than 4 hours without food? Do you get anxious? Do you feel angry? Do you pass out? And some people will after 4 hours. Does eating remedy your mental health issues? Does eating help you feel calmer? And I know there are other reasons, but one of the rule outs would be blood sugar instability. And do you crave uh, sugars and starches? Here's the third pillar: rest. Uh, Being sleep deprived is incredibly bad for mental health. Subjects who average 6 hours or less of sleep were 2.5 times more likely to have frequent mental distress. In our in our in sleep, our bodies shift into a healing mode, which allows for neuroprotective functions. And you can read this quote. I think it's pretty amazing. So not sleeping is highly stressful and can lead us into the cell danger response. Um, this is kind of a new thing that's coming up, which I think is pretty amazing. So sleep is often due to our bodies being out of sync with the environment. So before electricity, it was easy to be in sync. You went to sleep when it got dark, you got up when it got light. So sunlight signals our brain um, to be in the on switch, and then darkness signals our brain that it's time to go to sleep. But now that we have artificial light, now that we have screens, blue light screens, phones, televisions, uh, it can stimulate an awake state and the brain gets confused. We get circadian rhythm issues where we become out of sync. So, two hacks, simple hacks: as close to waking as possible, be in sunlight for 15 minutes a day. That's behavioral. We can do that. And no screens, dimming the lights 2 hours before bed. And if it's not possible, using filters on the screens or blue blocking glasses. But this tends to be, and going to sleep between around 10 o'clock can be another thing. But there's many hacks. These are just two very basic ones. Um, exercise, exercise as stress reduction, but remembering that over exercise can be experienced as by the brain as being stressful. So over exercising in a highly stressed or fatigued person can set them back, can exacerbate mental health symptoms. So in such cases, we're going to do gentle exercise, walks, building up over time, yoga, Pilates, gentleness. And I think many of us are really too hard on ourselves. And so we want to model gentleness when it comes to many things. So there's a large body of research. I have a citation here. I think most of you are probably pretty aware of this research. Exercise in the brain. Hippocampal neurogenesis and its protective role against disease, including mental health issues with exercise. Exercise increases brain plasticity, leading to better learning and memory, better attention and focus. So, exercise, finding the right exercise can be obviously important. The most important thing is helping people find things that they enjoy and will keep doing. So stress management, it I think stress management is incredibly underrated. So there's a normal stress response. We're designed to respond quickly when put in a threatening situation, like a near car accident. The sympathetic part of the autonomic nervous system, the fight flight branch, gets activated and triggers stress hormones, cortisol, adrenaline, and to deal with the threat. And when there's stress resilience, when the body is healthy, the body returns to homeostasis. And we can get on with our life. And this is the way that we're supposed to be, that we're designed to be. But very few of us are in this flexible state, stress management, stress resilience state. This is where many of us are. This is definitely where many of our clients are. It's when people are exposed to stressful experiences, acute experiences over long periods of time. And here we get stuck. We get triggered and we stay stuck in fight flight in the nervous system or freeze. And this is where we see mental health symptoms like worry, angst, anxiety, depression. And this chronic, so this is where nervous system dysregulation signals danger to the cells, and where we get into cell danger response. And then we're in loops, we're in limbic system loops that can be very, very difficult to get out of and lead to mind-body breakdowns. So I think we definitely underestimate the power of stress management tools. Many of our clients are in chronic limbic system trauma loops and chronic activation of fight, flight, freeze. And these end up being some of the biggest blocks to healing because they so strongly activate the cell danger response. So we see this, and this is very, very common in chronic illness, in things like in people that have autoimmune disorders, in people that have POTS and other chronic conditions, chronic fatigue, where they just get stuck and worn down. But certainly in mental health states where people are highly activated, anxiety, panic, insomnia, PTSD, fear, depression. And so stress comes in many forms. So calming the nervous system can take many forms as well. So with stress management, and there are probably people that are quite experienced with these tools, giving people options, helping them remember that that unwinding entrenched patterns requires daily and repetitive practice done with compassion. Okay, here's a little case. 30-year-old woman, Sabrina, main complaints, anxiety, ruminations, depression, lots of therapy, many medications. Some success starts and stops them, too many side effects. And she's sort of like, she's kind of a common patient, I would say. A common, not non-responder, but a kind of quasi-responder. She's tired, she's frustrated. And she came to me because she hears, oh, I deal with a whole person. So what did we do? So we sent her to her doc, and he ordered some of the testing we laid out, B12, D, CRP, ferritin, and just nothing fancy. And so I educated her about these so she could have an informed conversation with her doctor. I gave her printouts with some research articles that if the doctor was concerned, that he could look up. It made it easy for him. And I had a little paragraph about how each of these lab values were linked to different mental health conditions, and specifically Sabrina's condition. So she had low B12 and high CRP, C-reactive protein, which is a sign for inflammation. So I'm a therapist, and so what did I do? I gave psychoeducation. I told her to speak to her physician about any of these recommendations, to read up, to give informed consent. So I gave her information about an anti-inflammatory diet. I gave her a couple of daily breathing practices to help calm her nervous system. I gave her some education about sublingual B12. I gave her some information about talking to her doctor if she wanted to do intramuscular B12 injections. We gave her some fish oil for inflammation. And so she went off and did these for a couple of weeks. I continued to see her because I see her on a weekly basis. And so after a couple of weeks, she had symptoms consistent with low serotonin. So I helped her, I gave her information about doing a 5-HTP experiment for anxiety and ruminations. And I followed her weekly. And after about 3 months of doing these practices, she started to come to my yoga class as well. Her symptoms were 50% better. And then at the time, she was feeling more optimistic. She was feeling more open to try some things. So she was open to doing, 3 or 4 EMDR sessions, targeting some very specific traumas. And after another couple of months, she had another 15 or 20% improvement. But she was feeling much better and was more open to addressing some of the other lifestyle things and things she wasn't doing before. So here's my takeaway. And sort of my takeaway for you guys is by adding some really basic interventions, we can make big changes to our therapy clients. And these are things any of us can learn. And we don't need to know all the biochemistry to help start supporting our clients' bodies. So why should we learn about functional medicine as therapists? So I think the first thing is we can educate people. So most people don't get to see functional medicine doctors. So we may be the only person our client ever sees that's going to know anything about functional testing. So this is therapists as mental health first responders. And this knowledge, even if it's really limited, may change the course of their treatment. You may learn something tonight and think of a client and think of a young girl who's a vegan, who's anxious, and begin to sort of dig into that a little bit. We can collaborate better with medical professionals. So the more educated we become, we can be part of a client's care team. This is their allopathic doctors. This is their psychiatrists. This can open up conversations with other professionals. Not every professional is going to be excited and open to having those conversations, but finding a few like-minded professionals can be very, very rewarding. And if scope of practice allows, we might become functional medicine therapists that learn the 80% lifestyle, diet, mindset, and also the 20%. These are self-ordered functional medicine labs where we refer our clients to third parties to have functional medicine testing. And we can provide supplement protocols for people. But however we step into this, we're looking to expand our bag of tricks and offer whole person mental health care. So here are my takeaways. There is definitely a role for therapists in functional medicine. And there's also a role for functional medicine in therapy. Even if you never do testing, even if you're super concerned with scope of practice and you're like, I can't make recommendations, I certainly can't order medical tests, but I can learn to have a functional medicine hat. We can learn as much as we can about basic testing, educate people to go to their MDs, find local MDs that we can collaborate with. We can learn about the 80% of efficacy that functional medicine has from lifestyle, diet, and mindset. That most of functional medicine is stuff within our wheelhouse. And if we have a lifestyle framework to help prime the body for safety, healing, openness, and function, and then people's systems will take in functional medicine interventions like supplement protocols. The more you learn about functional medicine, the more you can help your clients. Become an integrative psychotherapist or even a functional medicine practitioner. The field desperately needs you and your clients need you. And by focusing on small changes, we can lead to big improvements in symptoms that haven't been touched by standard of care. So I just want to say, I want to thank you for being here. This has been amazing for me. And I want to say, I want to honor you guys for taking the risk to be here to learn something new. Probably there are people in the audience that know a lot, and there's probably brand new people. And remember, you don't have to learn all this at once. And you don't have to be an ordering clinician to benefit from the information. We just need to be teachable. We need to be willing to be courageous and learn new things. And if you're new to this, see if you can find other therapists in this world. There's dozens of people like me. There's probably hundreds of people like me that for years have been brave enough to show up at medical conferences and have people sneer at them, but who were open to learning with the sole interest in helping others and being of service. So here's some references. And that's it. So thank you so much. Thank you, Jim and Cindy. Thank you guys all for being here. And let's see, do we have some questions? Let's see. Cindy, have you looked at the questions? Let's see, questions. Your
Josh,
thoughts on Deplin?
we
Uh,
only have a couple minutes because it's 8:34, okay?
okay, so Deplin, I think methylfolate. Deplin is a very high dose methylfolate supplement put out by a pharmaceutical company. I think methylfolate is incredibly important for mental health. I think Deplin is often too high dose. It's 15 milligrams, I think. Jim, do you want to say something about Deplin?
No, I agree with you 100%. It might be a little high for some people, it can be overstimulating, but L-methylfolate is critically important to look at as a functional clinician. Absolutely.
Okay. What are some of the first steps a psychotherapist can take who can't order lab tests in order to integrate functional medicine into their sessions and practice? Emily, I think you did it by coming here tonight. And choosing, we're going to be offering a therapist intensive, I think sometime summer or fall. That would be something. There are many books on the subject. I would start reading. I would dig into the free resources at Psychiatry Redefined. Excellent free resources. There's many classes, paid classes for not very much money that are uber comprehensive. There's a lab that used to be called Great Plains. There's a functional medicine lab focused on mental health that Dr. Greenblatt works with or used to work with, is now called Mosaic. And they have a really excellent array of webinars and written material, blogs and stuff. Dr. Greenblatt has many on there. I assume they're still there, but on autism, on ADHD. I think finding different sources, whatever's interesting to you, and dig in. I would choose to chunk it down and not try to learn everything. To learn about some of the lifestyle things, to learn about diet tends to be a good place to start. Dr. Greenblatt has an excellent book on depression and other ADHD, anorexia. He's got a book on everything, I think. But
There's a few of
Dr.
them.
Greenblatt books, those are just amazing. But being teachable, finding a mentor, that sort of thing.
Well, we're gonna wrap up and just going through the chat and the questions. Josh, people really appreciated what you're doing and the overview. And I think there's some excitement about the intensive. So we'll make sure
Excellent.
everyone gets that link when we set it up in the end of the summer. But it'll be 4 or 5 sessions with social workers and Josh and naturopath, just kind of an overview to kind of get you started in this world of
Yeah.
functional medicine. So
And I
thank you.
think, can I say one thing?
Yeah, please.
I think focusing on just the first step, and then you take the second step, and then the third, like there's so much to learn, and you just like take some information and digest it and get used to it, and then learn the next thing. And then the way you build a house is by building brick by brick. So yeah, thank you so much. I really, this was really just incredible for me. So thank you for
Great.
being
Have a good night. Take care. Bye-bye.